Would you like a step-by-step guide to Part A of the OET Reading Subtest? Keep watching. Thanks for joining me today. I'm Sharon, and in this video we're going to talk about how to pass Part A of the OET Reading Subtest. We're going to go through a sample test step by step and question by question to give you lots of practice and help you succeed at answering difficult questions. I'm going to give you some general tips as well as specific information on how to find the answers. Since the OET reading subtest is the same for all healthcare professions, this video will help you if you're a doctor or a nurse or any other healthcare professional. This video is brought to you by Benchmark Education Solutions, and you can find us on the web at edubenchmark.com. Before we start, you'll want to download the free OET Reading Sample Practice Test so you can read along as we go through the test. You'll find the link in the description below. And while you're down there, don't forget to click on the subscribe button and hit the little bell, and you'll get notified every time we post a new video. So imagine for a minute that you're now an OET candidate sitting in the exam hall, and you've just received your Part A test paper. You will have 4 short texts to read, A, B, C, and D. You'll have 15 minutes to read all the texts and answer all 20 questions. You can imagine that time management is pretty important, but if you follow our tips, you'll learn how to answer all 20 questions in the 15 minutes given to you. Let's talk about 6 steps for your success on OET Reading Part A. We're going to take the time to go through an entire sample test, all 20 questions. Here's step 1. Skim the headings. To skim means to read something very quickly without thinking about every word. Try to skim the headings of the text in just a few seconds. You will need practice to master this skill. Headings are short words and phrases that describe what the following sections will be about. Search the text for these headings. Make a note of where they are and remember them. This is one of the most important skills you'll need to master for OET Reading Part A. Here are some examples of headings you may see in your reading. You can see that the headings are at the beginning of each section and describe what the section will cover. Read through these headings for the 4 texts, A, B, C, and D. Remember, you can always pause the video whenever you need more time. And here's step 2. Skim the questions. Always look quickly at the questions before you read the text. Pick out the key words. These are words you think will help you find the answer in the texts. Don't worry right now about where to find the answers. Let's look at an example. Here's question 8. Take a minute to read the question. What do you think some key words might be? In this question, the key words are names, 2 painkillers, and prescribe. Let's think for a second. The answer will most likely be nouns telling you the name of the medication. Since these are prescribed, they are most likely a form of treatment or management. Do you remember where you saw the words treatment or management when you skimmed through the headings in step 1? Yes, they're in text C. Do the same for all reading Part A questions very quickly and make a mental note of the keywords. Underline them with a pencil if you can. This strategy will save you time and improve your accuracy as well. Now here's step 3. Now start answering the questions. Start with questions 8 through 14, not question 1. Let's start quickly finding your answers. We advise you not to do questions 1 through 7 first. The reason for this is that writing the answers for questions 1 through 7 does not take much time. When you've finished questions 8 through 20, you'll have a better understanding of all the texts. So writing the answers from 1 through 7 won't be difficult. Let's give it a try. The answer for question 8 should be in the part where it talks about treatments. As we discovered, that is in text C. Are painkillers mentioned in that section? Here's where you can scan that part of text C quickly and look for the answers. There it is. Read the part before and after your keyword quickly. 2 types of medication are mentioned, ibuprofen and naproxen. There is your answer. This keyword strategy will help you, but don't forget that having a sufficient amount of vocabulary is also important. Here's question 9, so take a moment to read it. Be careful with keywords. Sometimes you may find synonyms, which are different words that mean the same thing. The keyword in this question is surgery. Logically, this information might be found under treatment. But wait, read the question again. It says, to confirm. So we are not talking about a treatment, but a diagnosis. Let's scan the texts. Diagnosis and treatment are both in text C. The word surgery appears in text C, but look, it comes under the subheading treatment of physical symptoms. The question is not asking about treatment, but about a diagnosis to confirm the illness. Scan the text again, and you will see that more towards the beginning there is a subheading called Clinical Assessment, and it says, can confirm the condition. The problem is that it doesn't contain the word surgery, but the word operation is a synonym for surgery, so this is it. Your answer should be laparoscopy. Let's do question 10. Take a minute to read the question. Let's highlight the keywords. Here you're looking for a term or a name. You also need to know about the situation where the blood goes back into the body instead of leaving the body. Think of all possible synonyms or other forms of the word that could be related to this. As a medical professional, you can guess that if menstrual blood goes back into the body, it is going to cause problems. In this case, it's endometriosis. So look for causes. You'll find that word in text B. Under the heading Causes of Endometriosis, you will find exactly what you need. Since the question is asking for the term, your answer is retrograde menstruation. Here's question 11. First, you must understand the question. It wants to know where, so your answer must be a place or a location. The keywords are lesions and ovarian disease. Ovarian disease is only mentioned in one place, and we remember that it was a bold heading, so this is a fairly simple question. Look at text A. When you read this section carefully, you'll find that the answer should be on or under the ovaries. Here's question 12. This is another easy question. There's only one place where dioxin is mentioned. Scan the paper quickly and locate it. Remember, you are looking for the thing that is affected by dioxin. This is in text B. The answer is simply the immune system and reproductive system. Question 13. Be sure you understand what you're being asked. The question wants to know how far. What could a possible answer be? There's only one place in the paper which mentions deep infiltrating endometriosis, which is a type of endometriosis, and that is in text A. Be very careful with your answer. Don't just see the figure 5 millimeters and immediately write it down. Remember, you need to read the parts before and after a possible answer. If you read carefully, you will see that the answer is not just 5 millimeters, but more than 5 millimeters. Let's do question 14. There is only one place that mentions the word endometrium, so scan for that word quickly. It's in text A. The word endometrium is in brackets. When you see this, it means that the word in brackets is explaining something which came immediately before it. Read the words before the bracket carefully and take the entire phrase, not just one word. Here, the answer is womb lining. How are you doing so far? Practicing like this will help you learn what to do, so you'll feel more comfortable and confident. Here's step 4. Keep going. Move on to the next section, questions 15 through 20. For this section, use the same strategies you used for questions 8 through 14. Let's look at question 15. In this question, our keywords are endometrial cells, menstruation, and cause inflammation and scarring. This question is tricky because the word endometrial is used many times in all 4 texts. If you find yourself getting stuck, just leave it. You can come back to it later. However, right now, we're going to try to tackle this question. Scan the paper and try to find the part where the word endometrial is used in relation to inflammation and scarring. There are actually 2 places that mention inflammation. One is in text A, which you see here. The other is in text D, this one. However, the one in text D talks about inflammation and not scarring. So let's go back and pay more attention to the part in text A. Here, the word menstruation is used, but it refers to the entire cycle and doesn't answer the question. In the same paragraph, you'll see a synonym for menstruation, period. Read on, and you will see the words lead to inflammation and scarring. This means the same thing as to cause inflammation and scarring. So what happens to the endometrial cells that cause inflammation and scarring? The answer is bleed. Let's look at question 16. Question 16 is hard because it's very vague and the keyword absence doesn't appear in any of the texts. So you'll have to think about other ways this information might be presented. Maybe absence can be replaced by not present or no something. You can also look at the keyword women and use that as a guide to help you locate the information. Look for the word women or woman, or possibly in this context you might find patients or people. You'll find this in text B. You found the information and it says may not have any symptoms. You need to think about which word will fit the blank in the sentence. It has to fit with an absence of, so the correct answer is symptoms. Question 17. Here's another tricky question. Let's look at our keywords, common type and do not burrow. Common type tells us that we're looking for a type or a kind. So this is most likely in text A. Since the word rarer is used in text A, and the question is asking for a common type of endometriosis, you can assume that the 3 types of endometriosis mentioned before the word rarer appears are the common ones. So which of the 3 is the answer? Is it superficial endometriosis, deep infiltrating endometriosis, or ovarian disease? The other keyword in this question is burrow, and you can see this word in the text. But wait, the question says do not burrow. So you can't just take the word burrow and think the answer is ovarian disease. That answer would be incorrect. Instead, we have a synonym, invade. Do not invade has the same meaning as do not burrow. So the answer should be superficial endometriosis. Here's question 18. This question contains a list. Some items in the list are already given: processed food, sugar, dairy, gluten. Your job is to find the next item. You'll find this in text D. In text D, you'll find the word avoiding, which is synonymous with stay away from. However, when you read the list, you'll find only the 4 items mentioned: processed food, sugar, dairy, gluten. There are no more items on the list. Don't panic. Remember our rule to read the parts before and after what you think might be the answer. If you keep reading, you'll see the words eating and avoiding again, and this time it says avoiding red meat. Aha! We discover that red meat is another food item and it can fit into our list. Your answer should be red meat. Question 19. In question 19, the keywords physical activity should guide you. The word physical actually appears in text C, which we see in this slide. However, if you look closer, even though it contains the same word physical, it doesn't contain the other things we're looking for, so we need to search again. This time, we'll look for a synonym to physical activity like exercise, jogging, swimming, and so forth. You'll find this in text D. Now consider the next keyword in the question, reduce. This word doesn't appear in this section, but there's another synonym here, lowering. We know we have the correct section. Read it again. What is reduced? Yes, the answer is estrogen levels. In question 20, the keyword is treatment. And you know by now that treatments are mentioned in text C. Look for text C, then look for parts where it talks about fertility. What other words are associated with fertility? Have babies, get pregnant. Use other keywords to guide you. Cannot guarantee, and you will find the section. Now that you've found this section, think about the best word to answer the question. It's obviously conceive. And we've finished the last question on the test. So now it's time for step 5. Now do questions 1 through 7. By this point in the test, you have a better idea of the information contained in each part. So in questions 1 through 7, you just need to indicate which text, A, B, C, or D, contains the information. Let's look at question 1. The keyword in question 1 is heredity. Since this word doesn't appear at all in the texts, you'll need to think of synonyms. If you can't think of any synonyms, then think about which category or heading this information might be under. Hereditary means inherited from. So it's probably about how a person can get endometriosis. This would fall under causes, which we know by now is in text B. Is there anything in text B that talks about the sickness being inherited? Yes, the word that tells you this is genetics. So your answer is B. In question 2, the keywords are locations and far from the womb. Think about locations far from the womb. Where could those be? The stomach? No, that's near the womb. What about ears, neck? Possibly, yes. Now scan your paper and you will find that text A talks about locations where endometriosis is found. Scan text A and you will easily find that information here. So your answer is A. Again, in question 3, the keyword exhaustion is not found in any of the texts. We're going to have to look for an expression that is similar. Think about the role of exhaustion in this context. Is it a cause, a symptom, a treatment, or something else? Logically, exhaustion is normally the result of a disease or a symptom. Do you remember which text talks about symptoms? Yes, it was text B. Let's check text B quickly and see if we can find something similar to exhaustion. Did you find the word fatigue? Your answer should be B. Let's do question 4. This question is about treatment, but there's a slight twist. It's talking about not getting treatment. We can start by looking at the text where treatment is mentioned, text C. By now, you should remember that without treatment is the same as not getting treatment, so you can answer C. As you read question 5, think about the role of a sleeping position during a period. Why do you think this might be relevant to endometriosis? Is it a cause of the illness? Maybe. Could it be a way to reduce pain? Possibly. Which text is most likely to contain this information? If you remember the headings and subheadings, you may remember the heading Self-Help Strategies to Manage Endometriosis, which is in text D. Scan text D first. The words sleeping, position, or period are not found in this section, but they can be summarized or inferred from what you can see in this excerpt from text D. Rest, lying on the side, and with knees pulled up to the chest. So your answer is D. Question 6 is another summary or inference question. Look at the question carefully. It's talking about childbearing years, which means the years or age that a woman is able to get pregnant. So you should be looking for a number that signifies age. Scan the paper for numbers, either spelled out or in numerical form, and you'll find it in text A. So your answer is A. Let's do the last question, question 7. This question talks about a relationship between pain and size. It says inversely, which means in an opposite manner. Let's look for words that are opposites of each other. This is tricky, so take some time to search the paper for this. It's your last question. You'll see this in text B. Don't forget to check that your proposed answer refers to the two variables in the question, pain and endometrial tissue. And we found it, so the answer is B. Finally, here's step 6. Now check your answers. And congratulations, you finished the test. If you have time, go back and check your answers. OET Reading Part A scoring is based on 1 point for each correct answer. If you skipped any questions, go back and write in a possible answer even if you're not sure. That's better than giving no answer, which wouldn't earn you any points. Here's a list of things to check. Spelling. If your spelling is wrong, the answer is only half correct. No marks are given if the answer is half correct because it's also half incorrect. Accuracy is very important. Correct form of the word as it appears in the text. You must use the word from the text in its correct form. Don't change the word form. However, it must still grammatically fit the sentence given in the question. Again, accuracy is important. Handwriting. Make a good effort to write legibly. Read all the sentences in questions 15 through 20 and make sure that the sentences make sense with your answer written in them. And good job! You've completed reading Part A. After you've completed Part A, put it out of your mind. Don't let it distract you from completing Parts B and C. Altogether, there are 20 questions in OET Reading Part A, 6 questions in OET Reading Part B, and 16 questions in OET Reading Part C. That's a total of 42 questions. So how many marks do you need to pass OET Reading? To get at least a B grade, or 350 out of 500 marks, which is the usual standard required pass for most registration purposes, you'll need to get at least 30 out of the 42 questions correct. If you can get all 20 of the questions in Part A correct, then you only need to get another 10 questions correct from both Parts B and C, where the questions can be much more challenging. Would you like more practice? Be sure to subscribe to our free OET course. Benchmark offers the latest OET computer-based, OET at home, and paper-based mock tests with world-class online OET training from healthcare professionals and ESL experts. Go to this link to join now. You'll also find a clickable link in the description below. And don't forget to visit our website, edubenchmark.com, for everything you need to succeed in the OET. Be sure to subscribe to our channel and watch for the next videos about OET Reading Parts B and C. I hope this video about Part A was helpful for you. Please leave a comment below. Thank you for watching, and I'll see you in the next video.